You're going to show us something today I'm excited about as it relates to cellulite. What you got for us?
We have the first and only FDA approved injection to treat moderate to severe cellulite in the bottom of women. And so, what I'll do is I'm actually going to walk you over. I'm treating my lovely patient, Shannon.
Okay.
And so you can see she's set up here. I'm going to pop on my mask.
Okay. And when you say to treat women, I mean, men can also have the treatment too, right?
So far, it's only FDA approved in women
Oh,
because the clinical trials were only done
oh,
on women. And so when we talk about cellulite, we're always talking about the dimpling. It's due to a
mhm.
thinning of skin, it's due to an enlargement of fat cells, and then to fibrous tethers that course through and kind of create that mattress-like effect in the fat. And so this is the first time we're actually demonstrating this even on television
So
because it
we're
was
the first
FDA
show to
approved.
have it.
They're the first show to have it because it was FDA approved in the summer. It's going to be launched in the spring of 2021. And it's really a first of its kind enzyme, which is called collagenase. And we're actually going in there and breaking up those fibrous tethers that cause the dimples of cellulite. And so what I'm going to do for Shannon here is I'm going to start injecting, and you can actually inject up to 12
Okay.
dimples per side or per cheek, if you
hmm
will,
hmm
and it's just a series of 3 shots in each dimple at different angles. And she's not numbed, but it's almost like the best analogy is like Botox for the butt
Yeah.
because we're not filling, we're using this enzyme to do its job under the surface and to break up the collagen. And over the next weeks, her body is going to reorganize what's called the extracellular matrix, and the tethers that create these dimples are going to release.
If you can explain again what the enzyme is doing inside.
Oh, sure. So this is a mix of 2 types of collagenase, collagenase type 1, and it breaks up type 1 and 3 collagen. And so the important thing to know is that it doesn't break up the collagen that's in your arteries or your nerves or
hmm
your veins,
Right.
but it does break up these tethers. Now, interestingly, the most common side effect from this is bruising because the little venules that are in your subcutaneous fat do rupture when we inject this. So, one thing I always tell people is that you will bruise from this no matter what. It
Sure.
looks a lot worse than it feels.
Right.
And interestingly, there's no restriction on your activity afterwards. She
Oh,
doesn't need to
good.
wear a compression garment. She doesn't need to do really anything. So obviously, we're not going to see results right away. This does take 3 treatments, 21 days apart. But I do have photos of a before and after the series of all 3. So you can see the difference this makes in terms of untethering those dimples.
Yeah. No, you can definitely see the difference here. People are going to want this, of course. How much does the injection cost, the cellulite injection cost?
So interestingly, we don't know yet because it hasn't been released, but my understanding is it's going to be comparable to a prestige injectable, more like a filler. And the exciting thing is that even after these 3 treatments, the results have already been studied for 4 years. We think that after that, the results are quite long lasting.
Wow.
Now, with respect to the devices I spoke about earlier, it really depends where you have the treatments. So, for example, the Vitas Bliss, it's about $750 per treatment. But say the Cool Tone is about $500 to $600 per treatment. So check it out. These are really exciting new technologies out there on the market.
Well, Dr. Batra, so many people are really trying to lose these stubborn fat cells, especially when diet and exercise just doesn't get those small pockets of fat. So these are great new devices. A lot of people are going to like them. So thanks for sharing them today.
Thank you so much for allowing me to share them with you, and thank you for having me.
All right. And of course, for more information on any of these procedures, just go to our website. You know it, thedoctorstv.com.